Hi, and welcome to Prescribing Possibility, conversations that inspire us to grow, heal, and live with harmony. I'm your host, Dr. Dympna Weil. Thanks for joining me, friends. So, thank you for joining me today, Dr. Simmons, on the Prescribing Possibility podcast. For those who maybe don't know much about the Dr. Lorna Breen Foundation, which I'm an ambassador and you are the chief medical officer, I'd love for you to give them an idea of the kind of work that the foundation does.
Sure. So the foundation is working towards mental health access and ideal workplace environments for all healthcare workers. It was started in 2020 after the death of Dr. Lorna Breen. She was an emergency medicine physician, the chair of emergency medicine at New York Presbyterian Hospital, came back from a family vacation to care for both patients and also her team at the beginning of the pandemic. And I think we can all remember the images coming out of New York in March and April of 2020. That's what Lorna rushed into to care for others. And she worked long hours. She ultimately got COVID herself, came back 24 hours after her fever broke, like many people did, saw an immense amount of death, an immense amount of suffering, patients dying without their family members present, worked to the point of emotional and physical and intellectual exhaustion, and needed some help. And she ended up being evacuated by car from New York down to Virginia, where she'd grown up, and received mental health care, the first ever in her life. And when she was discharged, she was so burdened by the fear that she would lose her medical license, her ability to practice, respect of her colleagues, and she expressed that fear to her family. Now, we lost Lorna to suicide soon after, and within 12 hours of her death, the New York Times had published an article about her life. And first dozens, and then hundreds, and now ultimately thousands of healthcare workers have reached out to her family and now to the foundation, sharing their own stories
Hmm.
and letting us know that Lorna was not alone in her concerns and her struggles, and that there's a real need.
Hmm.
So the foundation was born first to respond to those outpouring of voices, and ultimately, we crystallized our mission and our vision for a world where seeking mental health care is universally viewed as a sign of strength for healthcare workers,
Yes,
and the workplace environment is universally supportive of healthcare workers as human beings.
that is so resonant because as you mentioned that New York Times article, I remember seeing it and reading it and being completely heartbroken. Because the fact was, I felt that same pull about not wanting to seek care for fear of losing license or hospital privileges. And I live in New York, which has been rather protective of us, but it didn't matter because it's still that stigma attached to it, particularly in the healthcare community. So, yeah, go ahead.
And you make an excellent point, right? Like in New York, on the medical licensing application, no one asks you if you've been treated for a mental health condition.
Mm.
New York, at the time of Lorna's death, was one of 17 states that adhered to best practices. But without information,
Mhm.
care workers assume the worst, both in terms of what's going to be asked and what's going to be done with the information. And so that actually became one of our core missions, is to help organizations and states eliminate invasive and stigmatizing language from their licensing and credentialing applications and from their peer reference forms.
Mhm.
And then also to communicate that change to their healthcare workforce so that that perceived barrier to receiving mental health care is removed.
That I was gonna say that is and it's been working. I mean, this is the part that I think, you know, sometimes we feel like such a small part of things. This foundation has taken tragedy and has absolutely made such a difference in the lives of so many. How many programs have shifted in these short number of years?
So in 2022, we did a survey of the medical licensing boards in the states to see which boards were consistent with best practice standards, meaning they only ask about current impairment
Mhm,
for any reason. They don't specifically call out mental health, and they're not asking about lifetime history, right? And at that time, 19 states were consistent with best practice standards, up from 17 a couple of years previously. No hospitals that we were aware of at the time
mhm,
were consistent with those best practice standards when you took into account the peer reference form as well.
mm,
Meaning, we're not asking peers if they're aware of any history of a mental health condition or a substance use disorder. We're asking peers for actual knowledge of a current impairment,
right. Big
right?
difference.
Big difference. And so since that time, we've gone from 19 state medical boards to over 37 state medical boards. And we've started this process with the nursing boards, the pharmacy boards, and the dental board.
Mhm.
So that all told, we have well over 50 boards. Now, we're going to be updating those maps, and I'll tell you about the maps in a second, but we'll be updating numbers at the end of September.
Mhm.
And I'm happy to say that we'll be um, able to report much larger numbers than that. So in order,
Fantastic.
thank you. It's exciting to see this change happen and to accelerate the pace of change because I mean there were 19 states that had made the change, and that's largely because of the efforts of the Federation of State Medical
Mhm.
Boards and the Federation of State PHPs and the AMA. But we've been able to really shine a spotlight on this issue. And one of the ways we do that is through the maps. So
Mm.
we made a map
Yeah.
and we colored in the states that were consistent with best practices purple and we left the rest blue. And so we've been able to see that map fill in, but it's also a place, a source of truth for healthcare workers
Mhm.
to know, hey, an uninterested third party has looked at these states, right?
Mhm.
And they have done the assessment of whether they're consistent or not. And so if my state is purple, I'm not going to be asked.
Right.
And so we're also doing this with hospital credentialing. And so hospitals and health systems can also send us their credentialing application, their peer reference forms. We will provide technical assistance on how to change those and also award a badge once they're consistent with best practices.
It's like going back to the gold stars. I mean, who doesn't want the gold star, right?
Everybody wants a gold star. And so not only is it a badge of honor,
Mhm.
but it's also a communication tool.
Absolutely.
So it's a way to communicate to your hospitals, doctors, or nurses that they're not going to be asked.
Mhm.
We've been able to certify over 10% of the hospitals in the country since we started doing credentialing just over 2 years ago.
Amazing.
Not only the rate of change, but the rate of change. If you think back to like high school physics,
Yeah. I was like, "Ah."
is moving in the right direction. So the pace is accelerating on this change. And, I look forward to a day when healthcare workers can seek mental health care knowing that it's private
Mhm. Like everybody else.
like everybody else. And in my house, we call these Nunya questions.
None.
Like a business.
That's right.
If I'm not impaired in my role at my job, it's none of your business if I sought mental health care, just like it's none of your business what my hemoglobin A1C is
That's right.
or what my pap smear showed.
Right. It's no different.
It's no different.
So, Stephanie, I'm curious, like, can you tell us a little bit about the moment that this mission became personal for you?
That story starts way before my role with the foundation.
Mm.
So I've been a chief medical officer here for 2.5 years. Before that, I was a board member. But before the foundation even existed, I led the patient and clinician experience work for a large national medical group. And before that, a smaller regional medical group. My entire career, I've been engaged in this work. And my interest really started in residency.
Mhm.
So I was an emergency medicine resident in a 4-year program with a real interest in med ed
Mm.
and policy. I had my first child during my internship year, which was an act of ignorant bravery at the
I
time.
thought you were gonna say defiance, but no.
Yeah, no, ignorant bravery. Although that child is a lovely 20-year-old college student now, and I have no regrets. But it made for a tough residency, and
Mm.
despite that, I competed and matched into a RWJ fellowship. I was pregnant with my 2nd child, my 4th year of residency, and I had 2 things happen in really quick succession. I had the worst case of my career,
Mm.
and I developed postpartum depression or peripartum depression. And boy, could I have used help with both of those things.
Yes. Mm.
Both helped to process the trauma of the case, which not only was involved the death of a child, which I think is hard for everyone, but I also had to then testify at the murder trial for the child, which was its own set of challenges with my own 3-year-old at home and
Mm.
pregnant and with all of the, mood and dysphoria of a peripartum depression.
Mm.
I chose, and it was a choice, I chose not to seek care, to get diagnosed or treated because I was finishing my residency and I knew I'd be asked when I credentialed at the hospitals that and health systems that I wanted to work at,
Mm.
whether I had ever been treated or diagnosed. And I made the economic decision not to seek care in order not to hinder my career.
Mm.
As part of that decision making, I ended up dropping out of my fellowship, going into work right away. I did not have the early career experiences or joy that I could have
Mhm.
because I had quite a difficult few
I'm
years.
so sorry to hear that, and thank you for sharing it because so many go through similar experiences, and not often do we hear colleagues speak of it, so thank you for sharing that.
Yeah, it's my pleasure, and it's really only a story that I've started telling in the last couple of years.
Mhm.
So I knew that was wrong, right? Like my justice meter was going
Right,
off on right?
right.
Like here I've just like donated all this time and treasure and passion and talent into becoming a physician, and I'm not taking care of myself in this really vital way because I'm a physician. And so I poured myself into my family, but also my career. And I was doing quality and safety work. The MHA Keystone Initiative was happening in Michigan, which was Peter Provenost's work, which was all about safety culture,
Mhm.
very cool work. And I led that for my hospital. And a year or 2 out of residency, I was offered the opportunity to become the quality and safety director for my medical group, which had about 1,000 docs and a handful, about 30 contracts. And I said, I I think you can find somebody else to be a quality and safety director, but you don't have anyone looking after patient or clinician experience.
Mhm.
And I really think that that's what I'd like to do. So they said, we don't have that job, but why don't you write a job description and we'll see. And so I wrote a job description for what that would look like. And that was my first role in this area.
Stop. So you just decided that this is what I have a passion to do, this is how I can serve, and you just said, "This is it." And that was and they made it happen? Like, that's amazing.
I mean, I credit a couple of things. So, first, there was fertile ground
Mm.
for that suggestion to land on, both because I had a wonderful group of leaders that were really thoughtful and valued people
Mm.
and humanity. And I had also started to do some of the work and they were seeing some of the benefit.
Mm.
And I had built relationships with those individuals personally. So They had started to see the, like, benefit of the work, they trusted me, and they were just really, really good
Y
leaders.
and you asked, and I think that's, like, the big part of it, right? That sometimes we just don't even consider what we can do, like, what is possible because we're we're just so sure it can't possibly happen, right? So we don't even bother asking. So kudos to you for asking. I love it.
Well, that really started me down this road. So, in emergency medicine, there's been this story of sort of mergers and acquisitions of groups.
Mhm.
And as that happened with my group, I was kind of always part of the deal. And so I ended up doing this role for over 26,000 physicians across 36 states and 1,000 hospitals. And it gave me a lot of experience leading in a matrixed organization without authority, but with leadership
Mm,
and inspiring change. And, in 2019, we had just started to say, well, we're in all of these states. We've got leaders in all of these states. Why don't we use that as a way to advocate to change some of these questions?
yeah.
Like credentialing, and then the foundation arose and was doing just that. And so that's one of the reasons I was initially drawn to the work and partnered with them and ultimately came here to work full time.
That's amazing, and what a benefit I think the organization has with your experience, both as an emergency medicine physician, as well as in that leadership role. I think it goes a very long way to have somebody who's been walking that path to be able to speak to it. So, how do you feel like this work, like, I know that a lot of the work is actually at, like, the systems level, right? And it's legislative work and it's advocacy. But
Mhm.
for those people who are going to the hospital every day, the nurses, the doctors, the speech pathologists, all the people who have to get credentialed, how does this work impact their day to day?
Mhm. Mhm. Yeah, I had coffee with one of my friends from residency yesterday morning, and she said, "You're not the source of all that resilience training, are you?" And be like, "Do I need to dodge, A?" And B, no, that's not what we're doing. So, it was a great exercise in getting really concrete about the benefits. So, first of all, you'll have increased privacy when you renew your credentials or your licensing in the states and with the hospitals and health systems that we've been able to impact. Second, our federal level advocacy is with right now the reauthorization of the Dr. Lorna Breen Healthcare Provider Protection Act,
Mhm.
which is providing funding for organizations to reduce administrative burden for healthcare workers. So hopefully your day to day will be a little less burdened
Mhm.
with unnecessary administrative tasks, which we know is one of the prime drivers of burnout. Like, please just put me in front of a patient and
Yeah.
let me take care of somebody. Yeah, for sure. Third, we work in coalition with organizations from across the country, including the AMA, the ANA, the AHA, IHI, the doctors, the nurses, the pharmacists, right? To bring together all of those organizations, leaders who are working on workforce and professional well-being
Mhm.
into a coalition together to share information and knowledge. So all of the other organizations that are doing this work are learning from each other, and we're informed by their knowledge as well.
Mm.
And so that coalition is a ripple effect work where it's like, let's be a tide that can raise all the boats together that are working on this and thinking about things at a sophisticated level in a sophisticated way.
That's a wonderful thing to have all of that, to have everybody on board with that. And it sounds like it's a culture of care that's kind of evolving maybe.
That's the goal.
Mhm.
And I one of the things I love about this coalition is a lot of times I'll get off of the meeting It's every other week with this group of people, and I'll be, like, fired up and inspired.
Mm,
And so if everyone who's in those meetings is leaving fired up and inspired, then we're helping to continue the energy and the momentum around the work in all of those organizations,
mhm.
and that's a win.
That's a big win. Big, big, big win. Because I feel like a lot of things start off strong and then, they lose momentum, much like your friend was asking if this was all the resilience training. Like there's some resistance even at the ground level when the work is really intended to help. So that's an empowering thing to have all of those other groups aligned with the mission.
For sure, and the and circling back to the resilience training and actually how I ended up answering my friend
Mm,
too, it's a yes and.
yeah.
Right? We need to break down barriers to mental health access. We need to provide mental health access. We need great cultures and great leadership. We need the operational environment of care to be more effective and efficient.
Hmm.
And we need individuals who are informed and empowered to do the things they need to take care of themselves as well.
100%.
When you are talking to an ER doctor about sleeping 8 hours a night in the same place and the same time in a darkened, soundless room, resilience training misses the mark. Like, how am I how am I supposed to do that when I work days and evenings and
I
nights,
practiced
right?
OB. I totally get it.
Yeah, right? Right? So, there's the brand or the stripe of resilience training that I think often resonates the most with healthcare workers is, like, performance athletics.
Yeah.
Like, you are a performance athlete. You are having to perform physically, mentally, and emotionally at an extremely high level, and, oh, by the way, literally people's lives are on the line.
Right.
So take care of yourself, whatever that means, and, oh, by the way, even if you think you don't need sleep, you do because you're a human being.
Mm,
And if you don't think you need rest and a cognitive reset, you do because you're a human being, right? So think about how you can build those things in
mm.
to your life. It's not going to look like it does for the average person.
And it's not even going to look alike among, a cohort of doctors or a cohort of nurses. I think it's a very individualized sort of routine. And I think sometimes when we try to make it so cookie cutter and so, precisely check a box, that's when we lose everybody because no two people are the same in how they will receive the information and then how they will act on it.
That's right.
Yeah. It's amazing. I think one of the most empowering parts of being an ambassador with the foundation has been to hear all of these stories from other, clinical staff who maybe are sharing for the first time their struggles. And I think part of what many people don't recognize are these invisible injuries that people walk around with. And how do we address that?
It's it's so critical. I also think that there's been a real degradation of civility,
Mm,
not just not just in healthcare, but I think whenever people are stressed, it becomes more extreme.
mhm,
And so you're seeing people walking around fighting that hidden battle with their experiences, with their internal lives, with their emotional lives, and then not being given the space or the civility to be human in their work.
mm,
So, you know, I'm thinking back to my like low point, right? Which I shared earlier in our conversation. I don't think many people knew I was struggling.
mm,
I was actually crushing it in a lot of ways,
right.
you know? And I was very fortunate that I had a wonderful partner and a wonderful group to be a part of, medical group, and friends within that group who were supportive and wonderful and loving, even not fully knowing
Mm,
what was happening internally, right? I think without that, like, it would have been 10 times harder.
yeah.
So one of my favorite nurse leaders in the hospital I worked in had a sign on her window and it said, "Be nicer than you have to. Everyone's fighting a battle you don't know about."
Yes. Yeah.
And I think that's a good lesson in life, but in healthcare, it's like, you know, probably there's 5 or 6.
Yeah. It's not
Yeah.
double digits, right?
Which is
And the
yeah.
training, I think, too, encourages us to power through the pain or power through the discomfort. And so it's breaking down some of those, you know, like cultural rules, I guess, that we were taught to live by.
Sleep when you're dead,
Yeah.
suck it up buttercup, right?
Yep.
Like,
Yep.
all of that. My favorite analogy for that is the backpack. So, it's really important to be able to partition and endure as a healthcare worker, right? If you're delivering a baby and there's a postpartum hemorrhage and you've got 2 critically ill patients and one's not doing well, like, if you panic, you're gonna lose 2 people. If you lose one and you panic, you're gonna lose another. I mean, there's just and then somebody's gonna start delivering down the the hallway, right?
Yep.
I mean, like, you need to be able to partition and endure
Yep.
to be able to care for patients. So it's like you're carrying this backpack all the time and you're, like, chucking stuff in the backpack so you can keep hiking.
Mm,
But if you only ever chuck stuff in the backpack and you never take it out
yeah.
and you never deal with it or process it, eventually you're on your back. You're like a turtle, right? With your arms and legs waving in the air. You cannot get yourself up. And maybe with like a hand up, with some support, you can get yourself up for a little while.
Hmm.
Then you're just going to fall back over at some point unless you actually go through the process of taking the stuff out of the backpack.
And it's uncomfortable.
And it's uncomfortable.
Yeah. And not, no, I don't think many people are very at ease with discomfort when it can be avoided, right? I mean, it's against human nature, but I think particularly in healthcare, we see a lot of, we do a lot of wonderful work that's rewarding, but we also see some things that just, are not normal, let's say, right? And it does take a toll. Yeah, I
And
love that analogy.
they're not unseeable.
Yeah.
Right? You can't chuck it in the backpack. It's still there. It's still in your mind. However you visualize this, it's still in your heart, it's still in your soul. It has left a mark, a scar, and it it needs attention.
And this is why having those very restrictive questions off of all of the credentialing forms is so vital, right? That exact point. Just by doing your work, you are at risk of having to deal with these very heavy emotions, whether it's anxiety or depression or PTSD. I mean, it runs the gamut.
Or even the ability to unpack the backpack,
Yeah.
right? Without a formal diagnosis, but just having a professional to process
Hmm.
things with could actually prevent
Yeah.
a mental health condition, treatment or prophylactic treatment or treatment of a mental health condition could prevent a impairing mental health
Right.
condition. So the analogy I like to use is this is like if we demanded that every healthcare worker tell us if they ever got tested for a high blood sugar or hemoglobin A1C, because untreated diabetes is sometimes impairing,
Hmm.
right? And people were like, "Well, I don't want to get my blood sugar checked
Right.
because what if I have prediabetes and I can't get my license?"
Yeah.
Right?
Hmm.
And then all of a sudden, it's like you are not preventing impairment. People are going to get sick.
Right.
You are just preventing protection
Yeah.
and prevention and treatment.
Right.
And so we need to make sure that people can make good decisions
Mhm.
for themselves and their family that include treatment.
Yeah. That's excellent points. My thoughts now at this point are, we are, as this airs in September, and it is National Suicide Awareness Month,
Mhm.
which brings up a lot for a lot of different people and is a time when the foundation kind of reassesses. And you were mentioning maps before. So, and you said good things are coming. So as more and more states start to fall in line with best practices, what what is the foundation kind of looking towards in the future when all those states are complying and doing all the things to help their healthcare workers?
You mean after the nation has fixed licensing and credentialing, what are we gonna do next?
Yeah. You have
I
to be
love it.
talking about it because
Yeah.
it's getting close. Like, it's moving.
It's true, it's true. So a few things. First, we also have launched the All In for Mental Health
Mm.
program, which is 6 actions around access to mental health care for health workers. It includes privacy, but also education about how to unpack the backpack,
Mm.
maybe how not to chuck things in there that don't need to be chucked in the first place.
Mhm.
Throughout the lifespan of health workers, starting in education, alternatives to discipline, when impairment does occur, and clear pathways to return to work once impairment has resolved,
Mm.
so that healthcare workers have off ramps and on ramps when they need to take care of themselves.
Mhm.
And also protected peer support so that healthcare workers can have conversations with each other that are protected,
Mm.
and there is a lot of value to having a conversation with somebody who's been through what you've been through.
Oh, that's
Uh,
actually that point, and just to stick a pin right there for a second, that point alone is something that needs to be shouted from the mountaintops. We had something in my organization that I worked for when I was practicing as an OB hospitalist, and we did have a peer-to-peer support program, and it was underutilized, but when it was utilized, it was, uniformly effective at making people feel seen and heard and cared for, and that allows them to process as opposed to punish themselves.
I mean, loneliness and isolation are
Mhm.
killers, and connection is protective. So, whenever we can connect people and prevent isolation, that's critical. So, in addition to the All In for Mental Health campaign, the foundation is working with states and moving through the journey of licensing and credentialing, but then also leader education and learning collaboratives to implement best practices. So, whether that's in bidirectional communication, EHR
Mhm.
optimization, peer support, actually implementing some of those best practices, and to help organizations understand where they fall on the sort of spectrum of beginning to mature in their professional well-being
Mhm.
journeys in building systems that are supportive to the workforce. We've developed a maturity model called the Breen Scale to help organizations assess and know where they are. So that's a few of the things that we have in the hopper, Dympna, in addition to the licensing and credentialing work.
It's amazing, and the advocacy, because you were on the Hill not that long ago with
That's
Noah Wiley and his mom, who was
that's
who
right.
was a retired nurse. Do you wanna say a little something about that? That was just must have been thrilling, both to speak on the Hill about these issues that are so personal, but to have a little bit of celebrity clout is kind of incredible, really.
Super fun. It was not on my bingo card for 2025, to meet and do advocacy alongside Noah Wiley and his mom. So, The Pit, which is about to be in its 2nd season in early 2026, touches on issues of mental health for the healthcare workforce. And Noah Wiley has spoken out on behalf of the healthcare workforce and advocated as part of his role and also his role in producing that show. And so he joined the Figs Awesome Human Foundation and the Dr. Lorna Breen Heroes Foundation for a congressional briefing with some of the sponsors of the Dr. Lorna Breen Healthcare Provider Protection Reauthorization Act, as well as some healthcare workers, frontline workers, and his mom to talk about the importance of healthcare workforce and well-being for the healthcare workforce. It was a great day. It's always nice when you meet people who seem like they're really nice, good people, and they actually are really nice, good people.
Mhm.
I mean, so I for many people in emergency medicine, they went into ER because of the show ER.
Yeah.
And so, I think that was special and, also helped to raise awareness around the reauthorization and the need for healthcare worker advocacy in this space.
Yeah, particularly because of the popularity of the show, and I think for anybody who's listening who is not in healthcare, it's frightfully real, like realistic.
It's interesting to the 2 reactions that I get from my friends in healthcare about the show is watching it was actually, like, really difficult
Yeah.
because it evokes just viscerally what the experience of being in that environment is,
Mhm.
or I'm not gonna watch that show because I know it's gonna be too hard.
Yeah.
So it's interesting because, like, to your point of we avoid
Yeah.
discomfort, right?
Exactly.
Sometimes that's protective, and other times it's like, there's this thing that I'm like, well,
Mhm.
right? So I think for some folks, it's actually a vehicle to process as well. I'll tell you, there were multiple points in watching the first season when I needed to pause it,
Me too.
walk around a little bit, and take a breath. I also watched it with my kids. I have 3 kids now,
Mm.
old enough to watch the show. And I think they actually came away from that experience understanding me a
Mm.
little.
That's a beautiful statement and actually the most powerful part of art, isn't it? So because how do you explain those things to somebody who hasn't walked in your shoes? They do a really
Yeah.
great job of it. So
And why does mom maybe not get too worried about, like, a torn up knee
yeah,
when you fall off?
right.
All bleeding stops eventually, babe.
Yeah.
It's gonna be okay.
Why does mom say, "Please, you're not going to the birthday party at the trampoline park. Not happening."
Yes, yes.
That's my daughter's pet peeve, but anyway. But it's true, these are the things that
Yeah.
nobody really understands how we got that way.
I always say ankles and arms get better, necks do not recover in quite the same way, so we're gonna make our decision making and our risk taking accordingly.
I love that. That's awesome. So, Stephanie, as we kind of wind down a little bit in our conversation here, I wonder what gives you hope right now?
So many things. So, I am hopeful because of the change that I'm seeing happening in real time.
Mhm.
I am hopeful because of the involvement of our learners, particularly our students in this work and in this movement. I'm hopeful because the conversation around professional well-being for healthcare workers shifted in 2020.
Yeah.
For those of us who've been doing the work for a while, it was like knocking on a door
Mhm.
and it never cracked, right? And it's cracked now and it hasn't shut
Right.
again. There's still this conversation happening. Um, People are sharing their stories increasingly, which is not something that happened
Right.
when you and I were starting out, and I think there's power in that, and we're gonna continue to see movement.
Yeah. I love that. And there is a lot of reason for hope. And I think we're always going to need empathetic, compassionate humans to care for us.
Mm,
And it falls upon all of us to consider that, right? They're humans and they need our support. And so I want to thank you for the hard work that you put in. I've heard you speak at conferences. You're running around the country all the time in support of this. And it's such important work. And I want to thank you for the efforts that you put in, as well as everybody at the foundation. It's labor of love.
for sure. And thank you too for carrying the message forward, both as an ambassador and in your work. And for your listeners who may be in healthcare, remember that compassion is incomplete without self compassion. And make sure that you take care of yourself as well.
Thank you so much for that. All right. It was lovely speaking with you. And if people want to get in touch or want to know more about the foundation, how can they do that?
Sure. So we have a lot of the links for our work are available at our website,
Hmm.
which is Dr. Lorna, so Lorna Breen BREEN.org.
Hmm.
And there are ways that you can get involved as an ambassador, as a donor, with the credentialing work, writing your representatives, and we are all better together. So if you want to come on board and get involved, we'd love to have you.
I put that in the show notes, the links.
Perfect.
So
Thank you.
thank you so much.
Thanks for sharing your time with me here on Prescribing Possibility. I hope today's conversation offered you a breath of fresh air, a new perspective, or even just a moment of calm in the chaos of life. If this episode resonated with you, pass it along to a friend or a colleague. You never know who might need a little more harmony in their life today. I'd love to hear your thoughts, your questions, or topics you're curious about. Reach out to me anytime on Instagram or LinkedIn at Dympna Weil, or send me an email at podcast@dympnaweil.com. Until next time, give yourself the grace to grow, the space to rest, and the courage to imagine what's next.